Hi, everyone. Welcome again to another episode of Love Your Menses and Your Health, a conversation with Sister Docs. Today's topic of discussion is skin health during menstruation and menopause. We're excited today to have a lovely speaker. But before I introduce you to this lovely young lady, let me introduce myself to those of you that do not know me. My name is Dr. Azumah. I'm a board certified OBGYN, public health professional, community health educator, social entrepreneur. I'm the founder of Healthy and Uplifted, founder of Azumah Solutions, LLC, founder of Elevate Her Mind, co-founder and president of Love Your Menses. I'm also a doula certified life coach, consultant, blogger, professional speaker, and author. But today it's not about me. Today it's about a young lady. Before I introduce her, let's just do some disclaimer. By participating in this event, you grant permission to Love Your Menses and its affiliate the right to use your name, image, voice in any of our electronic, print, or multimedia publications. If you do not want to be want your images or your voice used, please contact us and we'll be sure to remove that images concerning or involving you. Please note that the information provided here is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. Yes, we're doctors, but today we're not serving as your doctor. We're serving as your community educator, which we love to do. All right, help me welcome my amazing speaker, Dr. Patricia Oyetakin. All right, you guys, she's a board certified dermatologist. She's so awesome. I've known this girl since we were younger. We went to the same medical school. You know what? Okay, can I just tell you something before I introduce her formally? She just celebrated her wedding anniversary like this past week, and I was at the wedding. It's so cool. It's so cool. It's so awesome. This is my friend. I love creating this webinar, Sister Doc webinar, because it allows me to share my friends with you all. My friends are so smart. Even before I talk about my friends, let me give a shout out to Laura Villarreal, who is my intern and always makes this possible. But yes, we are filled with love. We believe in love. And it's amazing to have Dr. Oyetakin with me. So let me tell you formally more about Dr. Oyetakin. Dr. Oyetakin attended medical school in Detroit, Michigan. She completed her clinical research and residency at Case Western Reserve and University Hospital in Cleveland. She has a lot to say about her. I limited this so that we can hear the information she has to share with us. Please follow her to get more information about what she does. But right now, she lives and practices in Atlanta, Georgia. So please join me in welcoming this young lady as she talks about something we are passionate about. And what is that? Loving your menses. And what else? Loving my menopause. Awesome. Welcome, Dr. Patricia.
Awesome. What a wonderful, warm welcome. Dr. Azumah is amazing. And again, I echo her sentiments as a great sister friend, remembering those days of long study nights, confusion, frustration, but the journey was worth it because we are so excited and feel privileged and blessed to be in our profession, being healers, educators, and hopefully you find some information from this presentation valuable, regardless of who you are, man, woman, young or old. There is something that I hope you can learn, share with a loved one, share with a friend, and really be a good advocate. So moving right along, I know Dr. Azumah gave a wonderful introduction. Just quickly about me, I was born and raised in Lagos, Nigeria, moved to Canada actually when I was 13 years old and went to Wayne State University for medical school and then research and training at Case Western. As you can see, I love dermatology. I love it all. And sometimes I feel like a jack of all trades, but I can't pick one. I love everything. I love the complex medical derm, the cosmetic procedures. I love working with my hands, doing surgery. And of course, based on my clinical research training, I do clinical research trials right now in clinical practice. I treat a lot of inflammatory skin disorders, psoriasis, eczema, hidradenitis. I do laser procedures. And if that is not enough, I also have another newfound interest in holistic integrative dermatology, evidence-based approaches to dermatologic care. So just bear with me. I can't get enough of dermatology. So today we are going to talk mainly about menses and menopause. I'm going to go over some very basic anatomy, nothing too dense, but just so you feel comfortable with the basic anatomy and as it relates to menstruation, menopause, and how it can affect your skin health. And I will, of course, share some tips and tricks, and hopefully we'll have some questions later on. So when we look at normal skin, so I want you to look at your skin. Sometimes we take for granted our skin and what the beautiful organ that it is. It's technically the largest organ of the body. If you think about your heart, you can hear or you can feel your heartbeat. Sometimes you can hear it depending on if you can really you're having your heart's racing. And also, when you think about your liver, your kidneys, you can't see those organs. Those are biologically, physiologically active organs, whereas your skin is something you can see. So sometimes we take it for granted, but it has, it has its own blood supply. Thank you for that comment. I try my best. It takes a lot of hard work to get good skin. So that's why I'm here to help. But your skin has nerves, it has blood vessels. And the key thing I want us to think about today also is the oil glands. You can see there's the oil glands, the sebaceous gland, the hair follicle. All of these are interconnected, and it's going to relate to what we're going to talk about. So then we're going to I get a lot of questions about day-to-day skincare routine, and this is just a general, and it will correlate to what I'll talk about earlier. So some basic fundamental principles: cleanse, treat, moisturize, protect. In the morning, you want to cleanse your face. Cleansing is not really just for removing dirt and oil. It's also for pH balance and helping maintain the skin barrier. That skin barrier is like the gatekeeper, or the thing that keeps in moisture, prevents all the harmful irritants. And then once you have a clean base, then you can use treatments, you can moisturize, and UV protection. And then next slide would show us that in the evening, it's a similar routine as well, but really at this time, we don't really need as much UV protection because it's at bedtime and we're focusing on treating and moisturizing the skin. Okay, so now thinking carefully about the menstrual cycle, we're going to start talking about the menstrual cycle. This diagram, again, it's not meant to overwhelm you. It's just to really give you a true appreciation of the complexities of the menstrual cycle phases. When we think about the menstrual cycle, the key word here is a cycle. There are many things in our bodies that are cycles. We don't think about it. You think about the physiological cycle of sleeping and waking, the hormones that regulate a lot of the functions in your body, whether it's breathing, digestion. We don't really think about that cyclical event and all the hormones that are interconnected. So the menstrual cycle is a normal physiological cycle. There's nothing wrong with the menstruation. It's a sign of healthy body, a changing body, just the way it was intended. The key thing to understand, though, is there are lots of very important hormones that coordinate between the brain, the body, the ovaries, the uterus, and they work synergistically in a coordinated fashion. So there are four main phases. And now, for the sake of simplicity, I'm just going to simplify it. Obviously, there's a little bit of overlap, but there's the menstruation, follicular, ovulation, and luteal phase. The key hormones are estrogen, progesterone. So if you remember nothing else, just remember those two key hormones: estrogen, progesterone. These are the things that will fluctuate to show up in our skin. When we experience symptoms that we see during the cycles, it's mainly related to the interconnection of those hormones. Now, looking at specifically the menstruation phase. So this is the phase that we all think about when we think of the word menses. This is that active shedding phase. Now, I'm starting at this phase because, again, it's the most notable that people think about when you say menstruation. You think about the active shedding. That's that period between 3 to 5 days. And the key thing about this phase is estrogen levels are very low. And I want you to remember that low estrogen, dry skin, low estrogen, sensitivity, low estrogen, lines and wrinkles. And that's a little teaser for what we're going to talk about later with menopause. So that low estrogen, thankfully in the menstruation phase, is short and brief during the active shedding phase of menses. But if you think about yourself or anybody that you've known during those 5 to 7-ish days, there's a lot of dryness, sensitivity, more pain sensitivity. You tend to notice more flaking and dryness, and some of the other factors that go into that are related to decreased blood flow to the skin and the interplay of different hormones, estrogen specifically. Now, some of the key tips I will give for this very specific menstrual phase. Number one is sleep, hydration, moisturization. You're like, wait a minute, you're supposed to be talking about the skin. Why are you talking about sleep? Because there are a lot of lifestyle factors that play a role into how our overall health and wellness that also come out in the skin. So sleep regulates, again, think about it. Sleep is a cycle. The body is a clever machine that has been so majestically designed. Everything is interconnected. The hormones, the sleep, they need on this cycle. So if you don't get the sleep, if you don't get the rest, if you don't give your skin an opportunity to rejuvenate, it will show up in the skin. And because we know there's dryness, hydration, both drinking plenty of water as well as hydration and moisturization from externally. And I'll talk about that. Now, this is the phase because of dryness, you tend to want to avoid things that we sometimes use for our skin that might be irritating. So when you think about acne products, acne is usually due to excess oil production. So a lot of the acne treatments like benzoyl peroxide, salicylic acid, they are drying out your skin on purpose, which is okay. But during this phase, we just want to avoid that. In addition, you want to avoid exfoliation and anything that might aggressively harm your skin. Now, waxing, threading, microdermabrasion, laser procedures, again, you might want to avoid it during this time because your skin barrier is very sensitive. So there is a higher likelihood of irritation and complications. And also because of another hormone called prostaglandins, you can also have more pain sensitivity. Yes, TMI, but I remember I got a laser procedure once during my cycle, and my cycles are normal, and I was in a lot of pain. And sometimes it's good to feel that so you can truly advise your patient, because it does happen. Now, looking at some of the skincare products, I am, a firm believer that majority of the things you need for your skin can easily be purchased over the counter, drugstore, Target, Walmart. Very rarely do you have to break the bank to have good skin. And in general, you need things that are hydrating. And if so, these are some of the common things I recommend every day in my clinic. Brands like La Roche-Posay, CeraVe, Aveeno. I also like some of the Korean beauty products like snail mucin. But in the next slide, it will show you some of the key ingredients that you should be looking for. Ceramides. Ceramides are building blocks of the skin. If you think about your skin organized like brick and there's the mortar in between that keeps it sealed and seals in that moisture, those building blocks, the ceramide is that glue that keeps it together. And the hyaluronic acid to prevent the moisture. Hyaluronic acid pulls in water, gives that plumpness. When you think about a kid that has a baby that has the dewy cheeks and is really, really plump, that's what we're talking about. Some oils are actually very good for your skin. But we have to be careful the type of oil because it's a balance. We don't want to use oils that are going to clog the pores, cause acne. Temporarily it might look like you're hydrated and moisturized, but really it can also clog the pores. So just some few examples of oils that are evidence-based based on their molecular weight that are actually good for the skin, hydrate without leaving you oily or increases the risk of acne. So specifically rosehip oil, jojoba oil, pomegranate seed oil, or argan oil. So please don't hate me. olive oil, coconut oil, avocado oil, corn oil, almond oil. I know sometimes these are passed down generationally. People recommend them. Some people can get away with them, and that's fine if you can. But in general, for acne prone skin, I do not recommend them. All right, so thinking again about the different phases. So we talked about menstruation phase. Key with menstruation is low estrogen and dryness, if you remember nothing else. Now, in the follicular phase, so this is coming out of that, specific cycle, active shedding, now the estrogen is starting to climb back up. If you remember that curve, so things are starting to climb back up. So now we're getting more hydration, and the collagen fibers and the elastin fibers are starting to kind of be built up again. Now, when you think about collagen and elastin in the skin, that's what's in that middle layer of the skin. If you remember from that original image of the skin anatomy, that middle layer is going to help us with the nerves, the blood vessels. And then if you think about when you see a house that's being built, before they put all the finishing touches, you see the structures, you see the beams, you see the anchors and all the things that keep that house in place so that when you go into the house, it doesn't collapse on you. In our middle layer of the skin, you have the same similar structures. The collagen, it's the building block. It really keeps that plumpness and that kind of sponginess of the skin. And then elastin, think of an elastic band. If you pull it, it snaps right back. But if that elastic fiber, if you've played with it too much, it stretches, it doesn't snap back the way it needs to. Unfortunately, that can happen with our skin. And so we're trying to encourage more collagen, encourage more elasticity. So in this follicular phase, as estrogen is climbing back up, you have an increased cell turnover. And what that means is our skin cells, they, again, on a cycle, our body is a majestic organ and a majestic machine. Everything is on a cycle. Our skin technically sheds every 28 days. And what's interesting? I never correlated this, but in doing this presentation, I realized a lot of things in the body are on that 28-day cycle. There's something about that, 28, 30 days. So that's what we normally want. So our skin is on a 28-day cycle. You think of the menstrual cycle as a 28 days, and it kind of coordinates where we want to see that increased cell turnover, that shedding. That's what gives us that dewy skin, that glow, because you shed the dead skin. And so during the follicular phase, a lot of people tend to feel radiant, as illustrated in these photos. They're very radiant. You have that youthful glow, you're feeling much better, you're more hydrated. So this is when you want to go back to your usual routine. You can use some of your chemical exfoliants, and then you can even get back to your topical retinoids, which are what helps with remodeling the skin and helping treat acne. And I just wanted to make a note. Notice I said chemical exfoliation, not mechanical. On the previous slide, if you just quickly, I put a big no to things like saying eye scrub, because those are too aggressive, can irritate the skin. So in the follicular phase, so the next slide will show that in the so the follicular phase, hydration, you can get back to your routine. And then the next phase is ovulation. So again, estrogen is creeping up. We're getting to that peak estrogen before it kind of climbs over the hill and drops off again. So in that ovulation phase, you're still hydrated, you're feeling plump, very moisturized. The skin pore size is small, and you're feeling like your best self. However, that's when oil production starts to increase, because progesterone is also starting to come into play here. And some people might notice, even though they're feeling great about their skin, they might notice some oil production, which is the precursor to kind of that premenstrual phase of acne. So in the ovulation phase, even though you're feeling great, I still encourage lots of hydration, also gentle exfoliation, chemical exfoliations. And this is where you might start to want to incorporate more kind of like your acne treatments for acne prone skin, whether it's, the chemical exfoliation, incorporating those benzoyl peroxide, salicylic acids, and also even some acne masks or even chemical peels. Now, the last phase we're going to talk about for menstruation is the luteal phase. And again, if you think about that image, I kind of cropped up that last image. because I wanted to demonstrate that progesterone is the key hormone in this phase. Not only does it go up sharply, it drops sharply. And that rise and fall is important because now you have that increased oil production, you have inflammation, you have breakouts, and then that dramatic drop. So this is typically where you have that premenstrual acne flare-ups, you have that more intense acne flares. And this is where, like I said, from the end of the ovulation phase into the luteal phase, before the next menstrual cycle shedding happens, we really want to optimize acne treatments. And those are the key ingredients that I mentioned, where we're really treating acne with anti-inflammatory ingredients like benzoyl peroxide, salicylic acid. Salicylic acid is a key ingredient for exfoliating the skin. Beta hydroxy acid, as well as topical retinoids and a mask for acne prone skin, and of course the acne patches that have become ever so popular. All right. So in the luteal phase, because of that rapid rise and drop of the progesterone, there are some skin conditions that we normally treat that tends to flare. Of course, acne, we've mentioned that. Hidradenitis suppurativa is a very common inflammatory disorder in the skin folds of the body, typically armpits, genital, groin, buttock area. And unfortunately, during this premenstrual luteal phase, you tend to see a lot of flare-ups in most women, actually. I see a lot of patients with hidradenitis. And so part of the treatments, I incorporate some of the hormonal treatments like oral birth control or a medicine called spironolactone. Now, psoriasis, eczema also can flare during this luteal phase. And the key takeaway from this is if you have been diagnosed with any inflammatory dermatologic conditions such as acne, hidradenitis, psoriasis, eczema, you really want to have a strategy, a plan with your dermatologist, because not only do you need maintenance treatment every day, you also need to think about, well, what if I'm flaring? What can I do to reduce the severity of the flare-ups or to get ahead of it so it's not as dramatic? So that is very important. And going back to some of the things I mentioned about acne flare-ups in the luteal phase, one of the tips and tricks I share with my patients are masks. Now, masks are something that are safe depending on the type of mask you use, and you can use that once or twice a week, especially if you're in that oily stage. And these are just simple masks you apply. No, you don't need to aggressively rub, and you rinse it off. And bentonite clay or kaolin are some of those masks that have been shown to help with oil production. And I'm just showing you some of the examples of things you can find over the counter with brands like Cetaphil, La Roche-Posay, as well as, again, going back to the tried and true benzoyl peroxide and salicylic acid. Now, I should pause before we move on. I wanted to pause and make mention of benzoyl peroxide. You've heard me talk about it a lot. It's a very important ingredient that we use for a lot of different things in dermatology as an anti-inflammatory, antibacterial treatment. Recent news reports, there's a study that came out of a very small research study that showed that benzoyl peroxide, if not stored properly in high temperatures, can actually turn into carcinogens. Now, before we get excited, the conditions that they had the benzoyl peroxide in was, I believe it was 50 degrees Celsius, which corresponds to 122 degrees Fahrenheit. Most people we don't keep our skincare products at that temperature. So with benzoyl peroxide, my recommendation is make sure you keep it at room temperature at all times. Check the expiry date and make sure it's not expired. In general, none of your skincare products you shouldn't be using any expired skincare products. Anyways, all right, so shifting gears now, we're going to talk about menopause. Menopause. I'm getting into that seasoned phase of life myself. I won't say how old I am, but yes, it happens. Like I said, it is a normal, healthy phase cycle through all of our lives. It happens. Preparedness is key. Now, this phrase in quotation, it sucks getting old. This is a phrase I hear all the time, every day. I see a lot of patients, a lot of elderly patients, and I hear this all the time. It sucks getting old because the aging process can be very unkind to a lot of people. And I feel like as a community, as a society, I'm glad there's more awareness talking about healthy aging, being very mindful of our elderly population, men and women, everyone in between, just to really help them through that journey and phase of life. So, as we talk about menopause, this was a really good schematic that I found from the GoodRx um, health company. And it really does a good job in summarizing in a color coded fashion just the different phases. Menopause is not something that happens as a snapshot in time. And there's so much variability from person to person that really it takes some good thoughtful introspection and thinking about, the premenstrual phase, sorry, the premenopause phases, when changes in period patterns start to happen, what we call now, the perimenopausal phase, menopause, and even postmenopause, because all of the symptoms are going to vary. And again, the key thing here is the estrogen production and when it starts to drop. And then now, another schematic, I like this because it kind of graphically, I'm a pictures person. I like the visual. That's why I think I love dermatology, because I can see my problems right before me and I can watch them change and improve. And again, going back to decreasing estrogen levels as the key driving factor with menopause. Now, this is again generalizing. Obviously, there are a lot more detailed intricacies, and usually it takes a multidisciplinary approach to kind of help walk our patients through a healthy menopause journey. But really, just understanding the estrogen levels and how you notice, even in 20s, your estrogen is not peak until about 35, late 30s, and then it slowly starts to decline. And like I alluded to before, with decreasing estrogen levels, you will see that reduced collagen and elastin. You notice a lot of patients, they often complain about the skin thinning, like when they pinch their skin, it feels like it's like paper thin. Poor wound healing, so they bruise easily because they don't have that thick collagen to protect the skin. Remember, I talked about those structures, those foundational structures in the skin, those pillars that keep the skin integrity and structure. And that's why we see more wrinkles, less hydration, and more discoloration. And so some of the key recommendations, first thing is UV damage. You know, tell me a dermatologist you've met that hasn't talked to you about UV damage, and I would be very shocked. We are very religious and preaching constantly about avoiding UV damage, regardless of your skin type. It's a fallacy that darker skin types do not need to protect themselves from the sun, because it can really impact your skin health. And this is something that you should be doing at all stages of life leading into menopause to reduce the risk of some of these additional damages that we see to collagen and elastin and the pigmentary disorders. And, it's really that cumulative lifetime exposure, but certainly even into menopause. And as we talk about healthy aging, you just continue to avoid the sun and limit exposure. Now, also want to recognize that we also want you to live a healthy, positive life, being outdoors, getting exercise. It's all about doing it safely. So protecting yourself with minimum SPF 30 sunscreen, and wearing hats, protecting the eyes from cataract damage, And clothing. Nowadays, you can find a lot of breathable, sun protective clothing that you can use for activities like running, hiking, tennis, because really we don't want to see some of these skin changes as well as broken blood vessels and skin cancer. Now, how do we improve skin texture? So if you're in early menopause, entering menopause, or even postmenopausal, what can you do? So there are ways you can improve skin texture. So topical retinoids, you've heard me talk about topical retinoids. I've mentioned that a lot. Topical retinoids are vitamin A derivatives. So vitamin A based molecules that have been made in a prescription form, or you can even find them over the counter. And what they do again is to help with encouraging that cell turnover, so you don't have as much clogging of the pores, helps with texture, fine lines, and wrinkle. And there's good evidence that it also helps rebuild collagen. In addition, glycolic acid, lactic acid, these are alpha hydroxy acids or examples of alpha hydroxy acids that also encourages that gentle exfoliation and cell turnover. So you may hear me, I mentioned chemical exfoliation, which is my preferred approach to safely um, exfoliating the skin without using harsh abrasive scrubs and molecules that might irritate the skin. And of course, chemical peels. Chemical peels, as illustrated here in one of the popular VI chemical peels, we're doing chemical peels either a series or once every, a few times a year can really help with that cell turnover and really help rejuvenate the skin. Other ways you can improve skin texture. So skin texture, how do you rebuild those building blocks? So now this is where we talk about procedures, cosmetic procedures such as microneedling, radiofrequency microneedling with energy, or laser resurfacing. And what we are doing in these cases is in the last bottom image, again, an illustration of a cartoon image of the skin cell structure. And where you see those wavy red lines, it's actually the laser or radio frequency energy going into the skin, creating these columns of energy. And in doing so, it actually stimulates an inflammatory reaction that actually rebuilds the collagen over time. These are very effective. I always want to set the right expectation with my patients. No, you're not going to walk out of there with smooth baby skin like you had when you were born. This is not 100% treatment, but it definitely makes a huge difference, especially if you combine it with some of the other treatments I mentioned and also the hydration and everything else. So I recommend them. Of course, they are not usually covered by insurance. They're usually an out-of-pocket expense. How else can we improve skin hydration? So topical moisturizers and molecules. I talked a lot about all the things you can get over the counter. Some of the key molecules in menopause you want to look for are peptides, hyaluronic acid, ceramides, glycerin molecules as well. Again, peptides are topical things you can put on the skin, usually mixed in with these heavier duty creams that, often, they're like in the nighttime creams, and that it really supports the skin barrier and can help reduce those fine lines and wrinkles. Before I move on to some of the hair changes, I don't think that slide came up, but I wanted to also talk about topical estrogen, specifically topical estriol. So during menopause, again, I talked about that multidisciplinary approach, hormone replacement therapy as an oral treatment or some vaginal suppositories can be very helpful for the other aspect of menopause. And your skin health is no exception. So you can use some topical estrogens or specifically estriols that have been shown to be very effective when combined with the hyaluronic acids and ceramides to address some of that dryness and that decreased estrogen levels to help stimulate collagen, fine lines, and wrinkles. There are some proprietary products or brands you can get on the market. For example, I know Paula's Choice has a phytoestrogen estriol product you can get at the store, as well as a company called Emapel. Emapel is a great company. They've actually been around for a very long time. They're one of the very few brands that started creating topical estrogen products for patients. So I'll put some of that information in the chat for you to just learn some more about um, those brands as well. All right. And so talking about hair changes, of course, because if you remember, the skin, hair and nails are all part of the skin structure. And what we see is that there's some shedding, there's some thinning. You notice a little bit of dryness, coarse changes in hair texture, and of course, graying of the hair. Some of that is, of course, related to estrogen, but also the physiological changes that happens with the decreased oil production as well. Now, how do you assess for hair thinning, hair loss appropriately? Now, so typically, if in the next slide, what it shows is we recommend seeing a dermatologist. And I'm not saying this to be facetious, but I truly see a lot of hair loss, a lot. And I take care of a lot of hair loss patients at different stages of life. And hair loss is very tricky because we use the term alopecia. It's an umbrella term, but there are different types of alopecia, all of which can manifest or even be more noticeable later in life. And so it's important to get accurate diagnosis because that's really going to guide treatment. Because if you have an inflammatory alopecia, you want to make sure you're being treated for that inflammation versus something that's non-inflammatory, non-scarring, because it really tailors the treatment. Having said that, some of the general treatments we use for the common types of hair loss we see later in life, female pattern hair loss, and that picture on the bottom illustrates that you can see topical minoxidil, which is known as Rogaine. You can see it over the counter, comes in a solution or a foam, as well as prescription finasteride or dutasteride. This is an anti-androgen molecule that is often used, or a testosterone blocker, as well as oral spironolactone. And oral spironolactone, again, is another medication that we use commonly. And oral minoxidil, low dose oral minoxidil as well. So almost like a low dose strength of oral Rogaine, essentially. Nail changes. Nail brittle can become more brittle, prone to splitting. My recommendation are sometimes our grooming practices need to be very careful, make sure we're not doing anything too harsh or damaging to the nail that can be drying. When you're moisturizing your hands, a lot of people don't think about it, but make sure you're really moisturizing the nail beds and the skin around the nails, and also checking for nutritional deficiencies, making sure you are eating a well-balanced diet. Next slide. There is a condition called vulva lichen sclerosis. We love big words in dermatology, but a lot of them are Latin based and they're usually more descriptive. So, vulva relates to the anatomy of where that is in the genital area of a woman. Lichen is a term that almost looks like a tree bark. And lichen is a word we see a lot in dermatology because a lot of things are descriptive based on how the lesions or the rash might look. And sclerosis, you think of a scar or something that looks like a shiny scar, like if you injure yourself and it looks very shiny. So that's really what it is. You're seeing in the vulva genital area of women, you see these kind of rough patches that are scar-like. And the key finding is that there's a lot of intense itching that can affect quality of life, sexual function, and just overall life, because you're just in a state of constant discomfort and itching. It is treatable. I see a lot of patients who suffer in silence. They think it's normal. They think it's something they've done, or they think, oh, it's just part of menopause. Please, if you know somebody, you've heard of somebody, and you think it's something, dermatologists are well trained in this condition, and even gynecologists just be find somebody you're comfortable to let them do a proper examination, because these conditions are treatable, so you don't have to suffer in silence. So this image, I really wanted to compile this because when we think about menopause, and as I alluded to earlier, healthy aging or aging in general, I see a lot of patients, and depending on the person, depending on how they're feeling or any other medical conditions they're dealing with, some people are coping very well and some people are not. And really, just like any stage of life, there are ups, there are downs, and there are periods where there might be more need for social support and also coordination with your medical care team to really get you through whatever phase you're going through. Devising a strategy. I think that's the key. What is my strategy? How am I going to get through this period, whether good or bad? Do I have the tools in my toolbox that I can reach for that are safe, that I've talked about with my doctor, that I can get through whatever phase? I think this current more vocal time that we're in, where women feel more free to talk about perimenopausal symptoms and menopause symptoms, and we are not just telling them they have to deal with it, because you don't have to deal with it. There are treatment available, and people are living longer, healthier lives, or living longer. So we have to make sure that they're healthy as they live longer. And so I wanted to mention, healthy aging and just general health again at every stage of life. Important lifestyle factors. I talked about my interest in integrative dermatology and how, the interconnected, the holistic approach. We have great medicines, like I mentioned, that are effective, can help us get through every stage of life. But there's some key principles that and I'm just pulling in from my patients that I see every day. The people that I see, that I talk to, I'm a talker. Unfortunately, sometimes it makes me run behind in clinic, but this is why I love medicine. I get to talk to people, get to learn from them, and they share with me their life experiences. And the people that I can perceive that are, doing a relatively good job of coping with healthy aging, they have a balance of social connections. They're exercising, even if it's just walking. They're engaging in lifelong learning, learning new things, learning from the grandkids how to use the computer. I mean, gosh, there's so much talk about AI, learning about how AI works, and, healthy diet. I want to pause on healthy diet because diet relates to so much that we do. I'm going to speak for myself. As I get busier in life, I tend not to think very much about, am I getting good carbs, healthy carbs, protein, healthy fats, because you're in a rush. You pick up a bagel or you just grab a soda, and it's so easy to just be on the go, or at work there's always food everywhere. You grab a snack and you're not really thinking about it. But what we put in our body is the fuel that we need. And it's also the building blocks of our hair, skin, and nails. All of those structures I talked about, the collagen, the skin, the nails, these are all protein structures. And 9 times out of 10, when I ask my aging patients, are you eating enough protein? When was the last time you had a piece of salmon? Oh, I just had a cup of tea, I had a toast and maybe some crackers. It's really important that we make, really focus on healthy, balanced diet with good protein. And sleep, of course, I mentioned sleep already. This can be quite a challenge because some of these hormonal fluctuations can be impactful on sleep. So, again, talking to a sleep specialist, talking to your doctor, even sometimes looking at your list of medications. Are there medications that you're taking that could be negatively impacting your sleep? Thanks for joining me today. I know I went I hope it was a good pace for everyone to really get a grasp and a good fund of knowledge about menopause, menses, all the different cycles and healthy journey that we go through in life that you can use to support a friend, a family member, just to encourage people that you know. And overall, I think as a community, as a society, it's important that we have these good fundamental knowledges about all the different physiological functions of the body and the skin. So where can you find me? I work in medical dermatology specialist in Sandy Springs, Georgia, which is just north of Atlanta, Georgia. I've been there for about 9 months working with Dr. Jamie Wiseman. It's great. It's busy, which I love, but it is busy. And we get to see a lot of amazing patients that we take care of, and as well doing clinical trials. I'm on social media, LinkedIn, Instagram, and TikTok. My handle are the same. So thank you very much.
Wow, thank you so much for this presentation. Wow, there was so many topics that you covered. It was just beautiful. All right, you took my topic from me. You talked about menstruation. I didn't give you permission to talk about menstruation, but it's all good. It's all good. You talked about really well. But you know what? I've trademarked menstruation. That's love your menses. You see, love your menses. We have the right to talk about menstruation, not you. I'm kidding.
You're
I'm
funny.
kidding. I'm kidding. I'm
You're
kidding. But
funny.
thank you so much for reviewing the menstrual cycle. It was just beautifully done. I mean, I enjoyed it, and I'm sure my intern Laura, who is a master's in public health student, is also enjoying it. We learned a lot, and man, we had more viewership than usual. So thank you. So you talked about the menstrual phase, the follicular phase, the ovulatory phase, the luteal phase, and you talked about products we need for each phase. How many products should we have? Like, I'm a little bit confused. Do I need to like say week one this product, week two that's kind of pricey, and then you come and talk to me
Yes,
like, oh,
it
it's
is
over the
very
counter.
pricey.
It's like you're confusing me. You're telling me to have four different products, and then you're telling me it's affordable. I'm not a dermatologist. You tell me in terms of
Well, listen. The key thing that you should take away from what I said is most people have a dry phase and an oily phase. If you had to think about it in those two categories, sometimes you're feeling dry, which is usually during that active shedding menstruation phase, and then sometimes you feel a little oily as you coming out of the follicular ovulatory phase, luteal phase. You start to feel oily. In general, I always, for example, the cleansers. Remember earlier on, I talked about cleansing. For me personally, I have two cleansers, benzoyl peroxide, and then I have something hydrating. When I'm feeling a little dry, I'm using my more hydrating, gentle cleanser. When I'm feeling oily, I reach for my benzoyl peroxide or my salicylic acid. It's either or. You don't need a whole lot. I am not an advocate of 10-step routines, a million products, because I'm a busy person. If I can't do it, I don't expect my patients to do it. I'm busy. I have two young kids. I help take care of my busy patients. So we have to be practical because anything that we do requires consistency. With like working out, I wish I could go to the gym and within a day get abs and never go again. But we know that's not true. With diet, we have to eat everything is consistency. So you have to get affordable products that you're going to use every day. So cleansers, something for dryness, something for oiliness. Now, the moisturizer is where you can cheat a little bit. You just need one or two good moisturizers. Some people like the feeling of hyaluronic acid. Some people like, the different formulation. But really, if you have a really good quality moisturizer, you're fine. CeraVe, La Roche-Posay, so with moisturizers, you need one. Sunscreen, you need one. You don't need multiple sunscreens. The other thing is the retinoids that I talk about. That's that prescription. You can get it over the counter as well, but that's something that you can get as a prescription. You only need one. So I know it was a lot and it seemed like it was in different phases, but truthfully, if you synthesize it, it's actually pretty straightforward.
wow. Okay, thank you for that. All right, you talked about sunscreen, how it's very important in all phases of life. You talked about the misnomer that people have about dark skin being protective against skin cancer. You want all of us to use sunscreen. All right. Okay. My question
Yes.
is wait a minute. My question here is in Africa, where people are trying to buy food, you're telling them to go use sunscreen. I'm confused. Let me speak for them. Let me speak for them. I say I'm a community educator. I like to represent the community. So my question is, how come they don't have as much skin cancer in Nigeria and they don't use sunscreen? Like, I don't know. Are you
Well,
trying to sell your product or like just tell me more of the data if
I
you can?
wish I had a product to sell. You're speaking prophetically, maybe, but no. I think the thing is, you have to understand skin. The presentation is for everyone, right? So
Yeah.
yes, you might not see as much skin cancer in darker skin types, but when it does occur, we have good evidence that unfortunately it's more advanced stages because of the misconception that people don't get skin cancer. The truth of the matter is, unfortunately, as somebody who loves my home country, I have family that still lives there. Unfortunately, our healthcare system are not equipped to even know the incidence data on skin cancers. So it's not that it's not happening. Do we have good data and evidence? And truthfully, we have more important things to worry about. Like, people are worrying about day to day necessities. And yes, sometimes skin cancer is a first world problem in a sense because people don't have the luxury to worry about some of these type of condition, and that's in general. However, having said that, we do know that with sun exposure, that intense sun exposure, one of the biggest things people complain about, even in Africa, even the people that are in the streets selling their produce, they think about the way their skin looks, the appearance, the discoloration, the dyspigmentation. It still happens. And unfortunately, instead of having healthy practices, which are affordable, they reach for harmful things like bleaching and all these other things that harm their skin and are toxic because they're trying to correct some of the unevenness, the skin tone. So, yes, um, sunscreen might not be easily accessible. I wish it were, or even just the sun safety. Like, if you go to, places that are not as economically places in China where people are still low income, you see them all the time. They look like Eskimos. They cover themselves head to toe. They're very diligent. They don't like the sun. I mean, of course, there's other more detailed conversation about the cultural implications and things like that, and all the things that go into that from a cultural, sociological perspective. But I think it's more the behavior and the understanding. Like I always say, God bless our African, grandparents, but ever since I've been a dermatologist, I see my African people. I'm like, why does your neck and your face look like three times darker and you see their belly or something else? It's because of the sun. And if it doesn't bother you, there's no need. But I think if it's a concern, it's something you definitely need to incorporate into your routine.
Wow, thank you so much for highlighting the fact that maybe the prevalence and incidence of skin cancer is underreported. I'm so glad you
Mhm.
said that. So the question now, let's talk about solution. When are you opening your sunscreen factory in Nigeria? Let's talk about it. Come on, give me that.
Amen.
I mean,
Amen.
come on now.
Amen.
I mean, you're saying
I
that we
know.
all need sunscreen. So find a solution.
Well,
Create a
so
company
this
in Nigeria. Go ahead.
So this is one of my pet peeves, and no shade to any of the companies. I work with a lot of great, skincare companies, but there's a lot of access issues in dermatology in general. I don't like the fact that my specialty that I dearly love is it's appears to be so inaccessible. And it's not a problem that any of us hardworking dermatologists created. A lot of us put our heads down, worked carefully, got to med school, and here we are. But unfortunately, over time, for many reasons, a lot of things are inaccessible, whether it's getting to a dermatologist or finding affordable products that you can use daily. I always pause. If I have to recommend something and I know there's no other option and it's in the triple digits, I always pause because I want you to be able to use it. So, yes, it's a huge need. Mass produce affordable, good quality sunscreens for our brothers and sisters in the continent and worldwide.
Awesome. So, how often should we apply sunscreen? 3 times a day, every time we go outside? What's your take?
Um, I use it every day, even if I'm indoors all day, even if I'm just sitting in it, because you're in front of your screen. Because we're not again, sunscreen is sort of a misnomer because we're not really protecting against sunshine. You're protecting against UV, ultraviolet light. So ultraviolet light, or light that emits from your computer screen, light
Right.
coming in
Oh
through the
my goodness.
window.
Where's my sunscreen? I'm always on the computer. Oh my goodness. Look at what I'm learning. Oh my goodness. Sunscreen to the rescue. Sorry, go ahead.
Yes, yes. So there's lots of things you can do. But again, I'm a practical person. I know sunscreen is hard because you put it on, you're supposed to reapply every 2 hours. Most people don't remember. Just being as diligent as you can, doing your best. Consistency is key. And also the other things you're doing to maintain the skin barrier health will also support your skin as well.
Wow, thank you so much. We've run out of time, but just one last question or comment. I thank you so much for talking about the menopause health and the negative psyche that some people have on
Yeah.
menopause. You talked about solutions to every problem. You talked about how there are challenges in every phase of reproduction in mostly females. So, what would be your take? How are you preparing for menopause? You said you're almost going to get there. I don't think you are, because the average age is 53. You still got a long way. This is a gynecologist
Hey,
talking,
hey, hey,
but
don't steal my secret. Don't.
well, you have a long way. That's what I'm saying. You have a long way. You don't say it's tomorrow, because I know your age. Okay, so how are you
Okay.
preparing? Mhm.
How am I preparing?
Yes.
I will start first and foremost with my support system. My husband, my family, my kids, and I'll tell you why. Because stress and how you manage stress, or how you have chosen to day stress management, because we always think big picture, but on a day-to-day basis, what do you have in place to manage stress? You're my sister. I can be personal with you. And I feel like my audience, we can be personal. I'm a believer, I'm a Christian. My faith is important to me. Whether it's your faith, whether it's meditation, something to really center yourself daily. Because when you're in the busyness and the chaos, you need that centeredness to really, that's for me personally, if you're asking me what I am doing. That's what I need to center myself. So it almost like I'm zen in the moment of like the storms around me. So I'm like, hey, listen, I'm not perfect. I might be late on this, delinquent on that. But at the end of the day, I try to center myself and do the best that I can. And the support system is important because those relationships are really is going to guide you through those phases and be your support. And it's a mutual exchange. Beyond that, I can't speak enough about sleep, diet, exercise. When patients come in and, a lot of the things we deal with, they say, oh, it's stress related. I try not to tell people, oh, manage stress. What does that mean? In the pandemic, we learned that what does that really mean? From a practical perspective, it means I ask my patients, instead of saying how you manage stress, I say, hey, what do you do for exercise? What type of exercises do you like? Not, we're not talking about weight loss. Weight loss is secondary. That will come. But what do you do? Because we know getting out in nature. When's the last time you walked around? When's the last time you walk around barefoot in the grass to be centered? When is the last time you looked at a flower and instead of being on your phone, you just looked at the flower and studied the detailed aspect of a beautiful flower? Because our world is so busy, and we go 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 go, we don't pause and really have wholesome quality time with ourselves and with people, with nature. And that there's very good evidence that it actually helps your mental health, stress. And the last thing I will say with regards to exercise, there is a lot of good evidence. Laura says her skincare is her self-care. Yes, I love it. Even for me, I'm like, hey, don't bother me. I'm moisturizing my face. That's my time. That's my time to really rub it in. I'm not listening. I'm moisturizing my face. But yes, the other thing I was gonna say, and I didn't get it in because I didn't want to overwhelm the audience, but there's actually very good evidence that aerobic exercise, cardiovascular exercise, as well as strength training, so lifting weights, it doesn't have to be heavy weights, actually builds collagen and elastin, you guys, in the skin.
Whoa, wow.
Yes, so if you needed another reason to be active, your skin will love you.
Wow, I just love how you captured the final statement, exercise. Because when we talk about menopausal health, you know, during menopause, when there's a drop in estrogen, there's a fight with weight gain. Like the weight wants
Yes.
to come in. We didn't talk
It's
about it
the
again.
mood. It's the mood. Your mood gets low, and yeah, there's a lot of it's a confluence of things.
Correct. Oh my goodness, this topic, a lot of people want to hear more about this. So maybe we need to do a conference. Like I said, Love Your Menses just launched a branch because we're moving now into the menopausal phase. So we want to
Yes,
along, we
yes,
want to
yes.
evolve. So we are doing, I love it. I love it. It's called Loving My Menopause. Loving
Of
My Menopause.
course.
So I think we're going to have
Yes.
a conference. If you will join me, where we talk about skin health. We see Defina here. Defina is our partner
Woo!
and our sister, also Dr. Allen. She just opened her obesity clinic with her husband, Dr. Chris Allen, as well, in Michigan. I don't know what part, but maybe we can all come together, do Loving My Menopause, and have like the exercise part, have Chris talk about the sleep part, have you talk about the skin part, and just bring this information to our community. We love educating you all. Thank you again, my sister
Absolutely. Thank
Patricia.
you. And I just wanted
Woo.
to quickly say to Abera, to Laura, and all her prior interns, Abera is a person that she will convince you to do whatever. She is a talker. She has been gifted with the gift or of coordination and visionary. Love Your Menses has really grown, and the work that she's doing in other countries, just providing basic encouragement and positivity to young women through these very pivotal stages in life. So please check out their website. Amazing, amazing.
Thank you so much. And I'm so blessed. I think you knew that we were going to talk about my team. Look at that. That was a good segue. I want to say thank you to the team that believes in us, believes in our vision. This is the group of people that work this behind the scene with me to make sure we love our menopause, make sure we love our menses, and just encourage people. Like my sister Patricia said, we are now in 8 different countries and counting. Please join us as we encourage people. Laura, thank you for being here. We love you. Laura is going to be graduating in May with her master's in public health. She's so beautiful. If you guys are looking for an amazing person to join your team as a full-time staff, please contact me. I would definitely recommend Laura. All right. So we're still talking about COVID. We ask you to get your booster shots because being healthy is very important. Like my sister Patricia just said, skin health is dependent on your physical health. You could also determine how you feel. We have some comments. Let me add that. That's from your sister. Oh, hi, Monique. That's so cool. Super informative. Thanks so much for this. I'm very proud of you, ladies. Thank you so much, Sister Monica. All right, the next thing is we're in Boston. We're going to be having an event with this great organization where we'll be talking about Haitian refugees in Boston. We want to celebrate them. We want to care for them. We want to let them know that we love them. So if you're in Boston, please join us on April 20th, 2024 from 10 to 2 p.m. Love Your Menses will be there handing out period products, encouragement, and meet us there. All right. We're also going to be in Connecticut. Again, tabling and handing out products to our youths. We're going to be there pitching our next program, which is our intercultural program. I love this program. This one time I went somewhere and I was like, have you guys heard of Flowtech for Girls? It is an amazing program. They're like, really? I was like, yes, it's a program whereby girls from the United States meet up with girls from Kenya, meet up with girls from Uganda, meet up with girls from Ghana, meets up with girls from Nigeria, meet up with girls from Liberia, and they just learn about menstruation, learn about technology, learn about public health. I was just like bragging about it. I was like, it is such a good program. Then the lady was like, who created the program? I was like, oh, we did. It was funny because I forgot that it was our team that created it, but it's a very good program. Right now, we have open registration. It's a 10-week program. We are going to be teaching them about machine learning. As my sister talked about artificial intelligence, we're going to be getting these young ladies ready and prepared
Is it
for
virtual?
it's virtual. It's from Zoom. Yes.
Awesome, awesome. That sounds amazing.
It's great. I mean, I really love it. We come 10-week weekends whereby we just come and teach the young girls. I love working with our Kenyan youths. We work with an orphanage, amazing ministry orphanage in Kenya. I do remember the first time we did piloted the cohort. There's one young girl, I would call her Grace. We were doing introduction of ourselves, and Grace was like, my name is Grace, I'm an orphan. I'm like, Grace, we know you're an orphan, but that's not your identity alone. There's more to you, Grace, than being an orphan. After the period of the program, Grace was just bubbly. Grace was just confident when she talks about menstruation. It was really cool to see the positive effect of just positive role modeling and mentoring and empowering our youth. It's really beautiful. It's just so beautiful. Join us if you want to register your kids so that they can see the other side of the world. Because I think a lot of times our American kids do not understand how blessed we are in this country. I'm not saying it's perfect. I'm grateful for the opportunity that we have and the ability to do what we want to do compared to other countries, especially the countries that we are collaborating with. All right. Love Your Menses. We are really passionate about providing period products. To date, since January, we have donated 7,713 products. Please join us to help us. I mean, it takes money to create a movement. We depend on you. So if you're touched and you want to support us, let us know. Thank you. All right, the next topic will be heart attack prevention in women. We will determine the date and time, but stay tuned. It's going to be fun again. We're going to have another sister doc come in and share her passion, as Dr. Patricia has just done. All right, I love to leave a departing word, and this is from Bryson Barasa. He's one of our team members. He said, our strength in Love Your Menses is our unity, in our ability to focus on serving our youths. Like I said, I'm very grateful to lead a team of amazing people. They're very intelligent. Most of them have a master's degree or getting one. But one thing that holds us there closely, like Laura, is our passion, truly passion for the youths, because we do know the youths are our future. All right, our sponsors for this program is Healthy and Uplifted, Love Your Menses, and Azumah Solutions. Please follow us as well on Facebook, like, share, until we meet again. We thank you so much. Thank you, Dr. Patricia, for coming. Thank you, Laura, for always serving us.
You.
Oh, this is so beautiful. Till we meet again. Thank you, everyone.